You have seen the videos, the perfect smile, the glowing before and after, the person holding up a whitening strip as if it were the secret to a better life. So you bought the strips. Maybe you wore the trays. Maybe you used the gel from your dentist and thought it must be safer because it came from a professional. And then it happened. That sharp, icy electric shock was the second time cold water touched one tooth. Not a dull ache, a fast stabbing jolt that felt like someone tapped the nerve with a tiny metal needle. And the strange part is, you probably kept going because your teeth were finally getting lighter. But here's the question most people never ask. What is whitening actually doing inside your tooth while you are chasing that brighter smile? Because the gap between what whitening promises and what whitening actually does to your enamel, your dentin, and your dental work is bigger than most people realize. By the end of this video, you are going to understand exactly how to get genuinely whiter teeth without burning your gums, creating permanent sensitivity, or building an expensive problem that only crowns or veneers can fix later. This is Mouth Secrets. If you care about a better smile without destroying the mouth behind it, subscribe now. What whitening actually does inside your tooth. Most people think whitening is a surface level thing. You put a strip on, the strip lifts the stain, you peel it off. Done. But that is not how peroxide whitening actually works. Peroxide does not sit on top of your enamel like soap on a plate. It moves through the tooth. Hydrogen peroxide and carbamide peroxide are small enough to pass through the microscopic pathways in your enamel and reach the layer underneath. That layer is called dentin. Dentin is softer than enamel, naturally more yellow, and much closer to the nerve. When peroxide reaches the dentin and breaks down the colored molecules trapped there, chromogens, your teeth look lighter. That chemical reaction is what you are paying for, whether you are using drugstore strips or a professional treatment. The problem is that the same process that whitens can also irritate the nerve tissue nearby. That is why cold water, cold air, and sweet foods can suddenly trigger that sharp, specific jolt. It is not random. It is your tooth telling you that the inside is reacting to what you put on the outside. And here's where people make the most costly mistake. They feel sensitivity, they see improvement, so they do it again and again. Because the logic feels obvious. If a little whitening worked, more should work better. But enamel does not regenerate like skin. If it thins or wears, your body cannot simply grow it back. And once sensitivity becomes your new normal, every cold drink, every cold breath, even a fork hitting the wrong tooth, you cannot undo that with another whitening session. That is the hidden cost no before and after photo ever shows you. When whitening goes wrong, sensitivity is the most common problem, but it is not the most expensive one. Gum damage. Peroxide is designed to interact with tooth structure. Your gum tissue is not tooth structure. It has no enamel to protect it. So when whitening gel leaks out of a poorly fitting strip or an overfilled tray, the soft tissue absorbs that chemical contact directly. What people describe as burning, tenderness, and pale or raw gum tissue is the gel reacting where it was never supposed to go. The patchwork smile. This is the one that surprises people most and costs the most. Peroxide whitening does not work on crowns. It does not work on veneers. It does not work on bonding or tooth-colored fillings. If your natural teeth get 2 or 3 shades lighter and the crown in your smile line stays exactly the same color, that crown now stands out. And the only fix is replacing the restoration to match the new shade. That can mean new bonding, new veneers, new crowns. We are talking anywhere from $800 to $2,500 per tooth. More appointments, more drilling, more decisions, all because no one had mapped the existing dental work before the whitening started. This is why a dental exam before whitening is not just advice, it is the step that can protect your wallet. The influencer. Whitening lies. Now let's talk about the hacks spreading online because some of them are doing real damage. Activated charcoal gets sold as a natural whitening secret, but charcoal does not move through your enamel the way peroxide does. It acts as an abrasive, it scrubs surface stains off, but it can also wear the enamel surface down. And when enamel thins, the naturally yellower dentin underneath shows through more. The very product people use to avoid yellow teeth can make yellowing worse over time. Lemon juice, marketed as gentle and natural, it is not. Lemon juice is acidic. Acid softens enamel. That is basic tooth chemistry. Rubbing lemon juice on your teeth is not a beauty secret. It is deliberate acid exposure, and you are calling the damage brightness. Purple toothpaste, a different category entirely. It does not bleach anything. Purple sits opposite yellow on the color wheel, so a violet tint can make yellow tones look less noticeable temporarily. But once you eat, drink, or brush, the effect disappears. It is a temporary visual filter, not a whitening treatment. Natural does not always mean safe. Viral does not always mean true. How to actually whiten without wrecking your mouth. Here is where the story changes, because white teeth are genuinely possible. A brighter smile is possible, but the right place to start is not the whitening aisle. The right place to start is the current health of your mouth. Before you whiten, you need to know whether you have active decay, gum recession, exposed roots, old bonding on a front tooth, crowns, veneers, or fillings that show in your smile. Pre-existing sensitivity. These factors change how whitening behaves and what results are even realistic. This is why a dental exam first matters. Not because dentists make whitening complicated, because your teeth have a history. And whitening does not care about that history. It reacts to the mouth it finds. Once your mouth is cleared, your two strongest options are in-office whitening, full gum protection, monitored application, adjustable and real-time custom-fitted trays from your dentist, not a boil and bite from a box. A tray made for your exact teeth so the gel stays on the tooth and not on the gum line. If you are using store-bought strips, respect the directions. Do not double the wear time. Do not stack multiple products. Do not whiten every day for weeks longer than instructed because you want one more shade. And if one tooth is significantly darker than the others, whitening strips cannot tell you why it changed. That single dark tooth may be trauma, an old injury, or a nerve issue. A dentist can tell you. Gel cannot. If you already whitened and your teeth hurt, first stop whitening temporarily. Mild sensitivity is common. Strong, lingering, or worsening pain is your signal to slow down and get help. Your saliva needs time to remineralize and buffer the surface. When people keep whitening through pain, they do not give the mouth a chance to recover. Second, shift your goal from whitening to recovery. A desensitizing toothpaste with potassium nitrate or a remineralizing toothpaste with hydroxyapatite can help. Use a soft brush. Avoid extreme temperatures. Give the mouth a break. Do not stack irritants. Do not use an abrasive whitening toothpaste if you are already sensitive. Do not rinse with anything acidic. Do not use charcoal to smooth the sensitivity away. That is like scraping sunburned skin to make it look better. And if the sensitivity is focused on one specific tooth, a tooth that throbs, lingers, or hurts when biting, call your dentist. That is not cosmetic discomfort. That may be decay, a crack, or nerve inflammation that is exposed to whitening. You do not want to guess wrong on that one. Whitening is not magic. It is chemistry, and chemistry needs rules. Your smile should not cost you your enamel. It should not cost you your gums. It should not cost you the comfort of drinking cold water. Whiten smarter. Protect the mouth first, chase the shade second. Subscribe to Mouth Secrets if you want dental advice explained in plain language before the internet sells you another product that your gums are going to regret. Your teeth can be brighter, but they should still feel like teeth when you are done.